One of our rounders who was able to pick up on some stroke-like symptoms and was able to provide us with a last known well time, was able to activate the appropriate interventions for care for that patient. The surgeon in turn was extremely impressed, as was the rest of the medical team, so we're very proud of her.
When I went to this particular patient's room, he was eating his dinner, and I saw that he had kind of stopped, so I asked him if he was done with his dinner tray, and he did not respond to me. You could tell that he was really trying to say something. He was trying to move his lips and he just couldn't. So I asked him 2 more times if he was through with his dinner, and at that point I knew something was wrong because I saw him walking 10 minutes earlier. So I went out and I got the nurse and I asked her what was going on with him, and I knew he had a carotid surgery because he had the dressing on his neck. And so we both went in. She assessed him. He was flaccid on the right side and he wasn't speaking, and they determined that he was having a stroke. Dr. Hepp told me that I saved his life and thanked me for catching it so quickly. That really made an impact on why we're going in and checking on these patients every hour, because if I wouldn't have gone in there, then who knows what could have happened.
My mom was here at the hospital about a month and a half ago. She was diagnosed with a metastatic brain tumor, which was the first diagnosis of this, so everything was a surprise to us. But we were here at the Elliot for quite some time, going from different floors, and the one employee that I can say stood out was the Purposeful rounder. They came in multiple times a day with there for different needs for my mom. My mom didn't have to ask for someone to come, they came. And it was also a great line of communication between us, that rounder, to reach out to the nurse if we needed the nurse. So it was just that person that, if we had a question, they were there, they came to us. And I can't speak enough about it.
They respond very well. Many of them enjoy it because they know that someone is coming around every hour.
And, whether it be just to talk to my mom and, share a few funny stories back and forth, but it definitely made an impact. Now, when my mom left the Elliot, she went to 2 different rehab facilities, received excellent care, but I go back and I look at the care she received from the Elliot. It stood out. And one of the main things that stood out was that Purposeful rounder. It was so reassuring. When we left, it was very hard. And to know someone would come every hour to check on her meant so much to my family. It really did. The Purposeful rounder made such a difference.
The dedicated Purposeful rounder has absolutely improved patient care and patient satisfaction.
This program is here to stay. I think we've had a tremendous start. I think we can make it better and stronger. There's so many people in this organization. The Elliot really is invested in this program, so I think we can only go up from here.